Hey, if you have posture that looks like this, well then you might have what's called anterior pelvic tilt, which can cause lower back pain, SI joint pain, even pain in your knees and ankles. Well, if you're not sure if you have it, we posted this short a few months back showing you how to test and see if you have it. Check it out. Hey, if you have an anterior pelvic tilt where your butt sticks out like this, guess what? That puts you at risk for lower back pain, for SI joint pain, and a myriad of different issues. So how do you know if you have an anterior pelvic tilt? I'm gonna show you exactly how to self-diagnose it while laying in bed. So lay in the bed, scoot your butt down to the end of the mattress right here. And what you wanna do is you wanna hug one knee and kind of bring it towards your armpit. Now from there, press the lower back into the ground and slowly let this leg come down. And what you wanna see is, does this lower back lift up like this? If it lifts up like this, or if you can't bring your leg all the way down, or if you feel an immense stretch coming to the front side of your thigh like this, it's a very high likelihood that your hip flexors, your psoas, all of these muscles are tight, which are pulling your pelvis into this position. And again, when your pelvis is pulled into this position, you're gonna be more susceptible to lower back pain, SI joint pain. So give this a shot, see if you have an anterior pelvic tilt, and stay tuned to the channel because we're gonna show you ways to fix it. Okay, if you just found out you had an anterior pelvic tilt, then here's the deal. I'm gonna talk about 3 different ways to change that postural position and actually fix this problem, which again, is causing you that lower back and SI joint pain that you wanna get relief from. So let's dive in. Okay, the first thing I wanna talk about is your hip flexors. Almost everyone who has that anterior pelvic tilt, where their pelvis is pointed like this, has tight hip flexors. And that's because the hip flexors run across the front of your hip, just like this piece of tape I put right here. And if this is tight, what happens is it brings the leg forward and it forces the tailbone and the butt and the pelvis to stick out more like this. So what we wanna do is we wanna create a little bit more length in the hip flexors, which allows us to go from this position to this position. Now, the good news is there's an easy way to stretch your hip flexors any time of the day while you're standing up and walking around, okay? So one of the things you can try to do is do this stretch throughout the day because it's gonna make a big difference on your hip flexors. And it's called the standing hip flexor stretch. So you're gonna start by standing nice and tall. You're gonna take a lunge step forward just like this. Make sure to have good balance on this by not pretending you're walking on one straight line, okay? So giving yourself space between your feet like this. Now from there, what you're gonna do is make sure your pelvis is straight forward. And the most important part is this. Tilt your pelvis down before you descend into the movement. Oftentimes when people come down into the hip flexor stretch, they do this, and all you're doing is dropping into what you think is a hip flexor stretch with an anterior pelvic tilt. So don't make that mistake, okay? Instead, tilt your pelvis down. So you're gonna try to imagine pointing your tailbone towards the ground like this. Keep it there the whole time. You can even put your hands there for support and make sure you're doing it. And then start to drop your pelvis towards your front heel. Now, as you do this, you'll start to feel a stretch real deep in the thigh, coming all the way through the front of the thigh, almost into the hip. In this position, what you can do is hold, try to imagine pushing down through the heel, imagine dropping your body weight towards that front heel, keeping the pelvis pulled down like this. Take a big breath in, and as you exhale, try to think about length, okay? And what I mean by that is this, you want length through the front of your hip. So don't just think about bringing your body down and everything's compressed, think about everything is long, length, 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 all the way from here through the back of the heel, length all the way through the core as you're letting your body descend and using gravity to stretch those hip flexor muscles, okay? Once you hold this position for around 30 seconds, 60 seconds, whatever feels comfortable, come back, reset, switch sides, again, making sure that the pelvis is pointed the right direction, so tailbone pointed down, and then repeat the process, really opening up those hip flexors. Now, what's great about this stretch is you can do it anywhere. You can do it while you're waiting in line, and nobody will even know you're stretching your hip flexors. You can stand up first thing in the morning, and you can just take a quick step forward and stretch your hip flexors. The more frequently you apply this hip flexor stretch, the quicker you're gonna go from the hip flexors being tight and pulling your pelvis into this position to them loosening up and allowing your pelvis to come back into this position. So make it a habit to stretch your hip flexors. One final tip for you here, you can pull out your phone, you can set an alarm on your phone 3 times a day and have it say hip flexor when that alarm goes off. And that's a reminder for you to stretch your hip flexors at least 3 times a day until they loosen up and this posture changes for you. Okay, the second thing I want to talk about is your shoes. Now, there's an important reason for this. You see, when the heel of a shoe is elevated like this and the toe is less elevated, that puts your body in a position where your heels are higher than your toes. Now, what that does to the body is this. The heels lift up and the pelvis tilts forward, putting you into an anterior pelvic tilt just because you're wearing shoes with a higher elevated heel. So instead of doing this, it's a really good idea if you have an anterior pelvic tilt to wear shoes that are much flatter. So ditch these high-heeled shoes, and instead, you could try shoes like this, with a nice flat sole all the way from heel to the front of the body. Oh, and by the way, we've had a lot of people asking, what's my favorite pair of shoes? You can check them out in the link below or go to WeShape.com/shoes to see what these ones are. Okay, the last thing I want to talk about is you practicing what's called a posterior pelvic tilt. Now you're here for an anterior pelvic tilt, which again is where the butt sticks down like this and the pelvis pokes forward. A posterior pelvic tilt is the opposite, where the pelvis comes underneath your body like this. Now, for some people, having too much of a posterior pelvic tilt can be a problem, but if you have anterior pelvic tilt, practicing a posterior pelvic tilt throughout the day can be really beneficial for you. So here's how this works. Make sure your toes are straight forward and your feet are right underneath your hips. You want to do this because you want to practice this position in a neutral stance, something that you would normally stand in during your day. Now, what you'll do is just relax and notice that you're in that anterior pelvic tilt with that slight arch in your lower back and your tailbone pointing upward. Now from there, it's helpful to put your hands on the sides of your hips, and I like to imagine that my pelvis at this point is a bowl of water. And what you're doing here is you're pouring the water out the front side of the bowl, right? From there, imagine you're trying to pour the water out of the back side of the bowl. So you're pouring the water the opposite direction by tilting the pelvis and squeezing the glute muscles to finish the motion. Then relax, come back to your starting position, and repeat this motion. Every time trying to tilt the pelvis backwards while squeezing the glutes. And something else to note here, you shouldn't be compressing yourself forward like this. This shouldn't make a core tension. This should think about, this happens while you also maintain a nice tall posture with the shoulders right underneath your ears, okay? Now you can practice this just like you did with the hip flexor stretch for 1 minute throughout the day. And every time we do this, we're resetting our body's sense of how it feels to be in a proper pelvic position. Now, this doesn't mean you should walk around with your pelvic position like this. Instead, we're practicing this to show you the difference and to create length in the hip flexors and strengthen the glutes at the same time. What we really want in the long run is you to have the awareness that this is going to cause aches, pains, or injuries to your lower back, SI joint, and even the rest of your lower body. And this, somewhere between full posterior pelvic tilt and anterior pelvic tilt in the middle, where your hands are balanced, that's where we want your pelvis. So we can start being aware of what it feels like to have that anterior pelvic tilt, the posterior pelvic tilt, creating a little bit more space and strength in the glutes, and then eventually noticing as I'm walking through the day, hey look, my hips are nice and flat. And again, using that bowl of water analogy, what does that mean? That means if your pelvis is a bowl of water and your hands are on your hips, well, all that water is sitting nice and flat inside the pelvis. That means your pelvis is balanced, that means your lower back is protected, and it's likely going to help out the rest of your lower body as well. I hope this video helped you fix your anterior pelvic tilt and make you feel better in your body. Now, if you're suffering with lower back pain or SI joint pain, well, then you got to check this out right here, because that's going to help you out immensely too. And also, sometimes it's hard to find a workout when you have that lower back pain, but we've got you at WeShape. You can build a free workout by clicking that link right there.